So welcome to the HR Huddle. I'm sure most of you know me. I'm Eloise Shelton from Vanilla Recruitment. We specialise in recruiting for office, sales, marketing, accountancy and HR. Welcome to the Huddle. We are joined by Keeley Baigent of KSAB Law, and she's going to share with us today what we should be doing to protect our employer and our employees with the new easing of COVID-19 restrictions. So today will probably be about an hour, maybe a shorter session. If you've got any questions as we're going along, please put them in the chat box and I will pose them to Keeley so she can answer your specific questions and as we're going along. It would be brilliant. And yeah, Keeley, I'll pass over to you.
Great. So hello, everyone, and welcome to today's HR Huddle on the topic that Eloise has just introduced of dealing with the easing of COVID-19 restrictions in the workplace. So as Eloise has said, please feel free to raise any questions as we go along and make comments in the comment box. So from Thursday, the 24th of February, the legal requirement to self-isolate following a positive test was removed, along with the self-isolation payments for those who are on low incomes. The right to claim statutory sick pay from the first day of a COVID-related absence was also removed, meaning that those who are ill with the virus will now only receive statutory sick pay from the third or after the first 3 waiting days, so from the 4th day of absence. Free COVID-19 lateral flow tests and PCR tests will be axed from the 1st of April, with the public and organisations being asked to buy their own tests. In January alone, the testing programme cost the UK £2 billion. So hence the reason why those tests are now being pushed onto the individual and organisations, or the cost of those. Boris Johnson told MPs, while the pandemic is not over, we have passed the peak of the Omicron wave, with cases falling and hospitalisations in England now fewer than 10,000 and still falling. Now we have the chance to complete that transition back towards normality while maintaining the contingencies to respond to a resurgence of a new variant. He went on to say that scientists are certain there will be new variants and it's very possible that those will be worse than Omicron. So with the easing then of those restrictions and the government support, but with a high possibility of new variants developing, particularly later in the year when the colder weather comes, employers do need to be cautious and to remember their legal duty to keep employees safe at work. So what should employees be doing then with the easing of the restrictions? The main thing for employers to consider is to update or put in place their own COVID-19 policies that are operating. So this should then be communicated to all employees so that everyone is clear about what the expectations on them are and how the employer is going to keep them safe at work. So what does the policy need to cover? I'm going to switch on and share on my slides, which will give you the detail, the written detail. So firstly then, this policy, we need to consider whether the employer will require employees to self-isolate if they test positive for COVID-19, and if so, for how long. Legally, there is nothing preventing an employee from going to work if they have COVID, just like with any other illness. However, the government and NHS guidance states that an employee should still stay at home if they have symptoms or test positive in order to protect others. The government guidance states there is no longer a legal requirement for people with coronavirus to self-isolate. However, if you have any of the main symptoms of COVID-19 or a positive test result, the public health advice is to stay at home and avoid contact with other people. So hence, don't come to work. The NHS advises that if you have any of the main symptoms of coronavirus, you should also take a PCR test. According to the BBC, the NHS England bosses have written to the healthcare staff outlining that if they test positive for COVID-19, they should not go to work until they have had 2 negative lateral flow tests taken 24 hours apart and at least 5 days after the initial positive result. Similar advice is operating in the education sector, and I believe advice is being given to employees from a number of organisations along the same lines. After the 1st of April, the advice on self-isolation will change so that people will be encouraged to exercise personal responsibility, as those who have flu are encouraged to be considerate to others. So that's the big change from April. According to a poll then of 250 businesses by an HR software firm, almost 1 in 3 UK employers will not require staff who test positive to self-isolate when the remaining restrictions are lifted. Nearly half, that's 48%, are planning to tell staff with COVID to stay at home, while 21% are still unsure how they will deal with the imminent easing of the self-isolation restrictions. The same HR software firm, the people officer from there, Claire Williams, said, environments that are purely office-based, where a large proportion of employees will have been vaccinated, employers may take the view that employees should use their common sense and treat it like any other flu or illness. Don't work if you are unwell and be conscious of not coming into the office and spreading any bugs. However, other employers will understandably take a far more cautious approach. If, for example, you work in the healthcare or social care sector, it's more likely that employers will want their employees to be testing negative and to self-isolate to minimise transition. There is certainly no right or wrong in this scenario now, and it has to be assessed as per any other risk that a company is presented with. So it's passing the burden of assessing that risk onto the employer. It might well be that if an employer operates in a public-facing sector, they will want to adopt a similar approach to the health and social care sector, requiring their employees to isolate for at least 5 days and have 2 negative flow tests taken 24 hours apart before they return to work. However, there are going to be cost implications for the employer if the employer wishes to do that, and I'll come on to those in a moment. An employer may require a shorter self-isolation period, but in determining the duration of the self-isolation period, it's important to consider how long a person may be contagious with the virus and at risk of spreading it to someone else. For previous variants of the virus, the World Health Organization said symptoms could begin to develop anywhere between 2 days and 2 weeks after infection. However, the incubation period for Omicron and its offshoots is believed to be much shorter and between 3 and 5 days. It's believed that people are at their most infectious 1 or 2 days before the onset of symptoms and during the 2 to 3 days afterwards. Public health experts are stating that it is taking less time from when someone is exposed to COVID to potentially develop infection and have symptoms. And it's taking less time for people then to recover from those symptoms. This is because obviously more people are being vaccinated. Data shows that the majority of people are no longer infectious 7 days after beginning to experience symptoms or first testing positive, particularly when vaccinated. And the vast majority of people are no longer infectious after 10 days. Most people will stop testing positive within 10 days of starting to experience symptoms or receiving their first positive test. However, it's important to consider that it is possible to continue testing positive for weeks or sometimes even months after having the virus, albeit rare. Saying that even if a person is continuing to test positive after a long time, it is unlikely that they're actually going to be contagious. Employers may need to deal with that scenario in their policies. If the employee can or does work from home, the situation will obviously be much easier to deal with. Employers can require the employee to remain working from home and not obviously to attend meetings in the office or outside the office with colleagues or clients, and state for how long. So state how long that isolation period is going to be. But of course, the employee is still working, and therefore, as I say, it's going to be much easier for the employer to deal with. Clearly, if the employee is experiencing symptoms that prevent them from even working at home, then they will be classed as being on sick leave and remunerated accordingly. Obviously, for those employees who need to work at the employer's premises or site and who can't work from home, then the employee will be unable to conduct any work during the stated isolation period. So employers will need to determine if this should be categorised as sick leave, if the employee isn't experiencing any symptoms, and if they aren't experiencing symptoms, then obviously they're ready and willing to work, but the employer is requiring them not to work. So what will be the pay implications of that? Will it be sick pay or will it be full pay? So more to consider if the employee can't work from home. So the second matter to cover in the employer's policy is whether the employer will pay employee sick pay if they are isolating. And this leads on from the matter I've just mentioned. So previously it was the case that statutory sick pay could be paid to an employee from the first day of incapacity in respect of a COVID-19 related absence from work. With effect, though, from the 24th of March, the COVID-19 provisions relating to SSP ended, and this means that statutory sick pay can no longer be claimed from the first day of a COVID-19 related absence. Employers will now have to decide whether to pay sick pay to employees who they require to self-isolate. The likelihood is, of course, that if an employee is ill with COVID-19 symptoms, or if they've tested positive, they will be absent from work due to illness, and therefore the employer's usual sick pay provisions will apply in that situation. SSP doesn't commence until the 4th day of an employee's absence due to illness or injury, so after the first 3 waiting days. So now that the SSP provision for a COVID-19 related absence is not payable for the first 3 waiting days, it will be up to you to determine whether or not to pay for those 3 waiting days or not to pay. And if you're going to pay, are you going to pay the equivalent of SSP or are you going to pay full pay? If the employer usually pays full pay for the first 3 waiting days of an employee's absence due to illness or injury, then this should arguably apply to an employee's absence due to an employee exhibiting symptoms of COVID or testing positive to COVID. So employers' usual sick pay provision will apply in that scenario. First 3 waiting days, full pay, and then the SSP provision kicks in. If the employer tops up the SSP from the 4th day, then again, that will apply in this scenario. However, there are many employers who don't generally pay employees the first 3 waiting days of sickness absence before statutory sick pay applies. And further to the government's decision to withdraw the SSP for the first 3 waiting days in respect of any COVID-related sickness absence, it's then for the employer to decide whether or not to pay for those 3 waiting days. Clearly, if no pay applies for the first 3 waiting days, this may, of course, result in the employees attending the workplace to obviously receive remuneration, despite having tested positive for COVID. So you need to think about those implications and the spreading of COVID in that scenario. I've also got to mention that under the statutory sick pay rebate scheme, employers with fewer than 250 employees could reclaim the statutory sick pay paid to employees in respect of the first 14 days of COVID-19 related absence. From the 17th of March, that rebate scheme has closed, which means that those employers can no longer recover SSP for the 14 days. So again, that's going to be an additional financial burden on the employer with 250 employees or less to pay the statutory sick pay in the circumstances I've just referred to, i.e. the 14 days of isolation, if that's what the employer requires the employee to have. The third matter then to include in your policy is whether an employee's absence for COVID-related reason will trigger action under your absence management procedure. So it might be the case that an employer confirms in their policy that a period of absence caused by COVID, whether because of infection or due to self-isolation, will actually be disregarded for the purposes of the absence threshold at which formal action under their absence management procedure applies. Alternatively, the employer may decide otherwise and say that the COVID-related absence should actually be counted towards triggering the threshold at which the absence management procedure starts. Where an employer doesn't wish to disregard the COVID-related absence in triggering the threshold, it should bear in mind that employees with some disabilities, such as autoimmune conditions, respiratory conditions, or diabetes, are likely to suffer more severe symptoms and therefore take greater time off work if they catch the virus, or may be more likely to self-isolate due to the potential risks of catching the virus. So just be careful in that scenario. So to avoid any potential disability discrimination issues, employers really need to be considering disregarding some or all of the COVID absence for those employees in those situations. The fourth matter then to consider is whether the policy, within the policy, is whether the employer will actually require mandatory testing. It's a voluntary decision for employers to run testing programs for their staff. However, the current guidance advises that the government wants as many employers as possible to sign up to regular testing of their employees to reduce the transmission of COVID among those who cannot work from home. It's currently recommended that private sector employers offer their workforce who are on site access to a minimum of 2 lateral flow tests every week. And the current guidance suggests 3 options for employers. The first is an employer-led program, i.e. set up by the employer on the employer's site. The second is a third-party provider. So a third-party provider comes in and does the testing. And thirdly, community testing, where the employer requires the employees to use public to use public testing or lateral flow tests. If the employer is going to require mandatory testing going forwards, it will need to consider and confirm when testing is required. Will this be on a regular basis, even if no symptoms are being experienced, for example? Or in the alternative, will the employer only require testing if symptoms are being experienced? I think most employers are going to choose the latter of those two options. The employer will also need to consider and confirm whether any mandatory testing is to be conducted, where the testing is to be conducted, and how the test results should be communicated and processed. So if an employer is requiring the employee to take a test if they are exhibiting symptoms, then the employer will need to confirm that the employee is required to take a test at home, or alternatively on the employer's premises, albeit you're not really going to want them on the premises to take the test. And then the employer will need to consider how they're going to view the test. So is it a photograph sent by the employee on the employee's work device? How are you going to check that that's the employee's test? But of course, that's happening at the moment. Is it somebody else's test or is it their test? So all those considerations need to be thought through and then detailed in the policy. There are some suggestions that employers with staff who have direct contact with the public may want to have mandatory testing, which may or may not be when an employee is experiencing symptoms. In other sectors, an employer may only require testing if the employee is experiencing symptoms. And as I say, I think that latter scenario is going to be the most popular. Whether an employer can actually require employees to take a COVID test involves a number of considerations, including at least a couple of legal issues. Firstly, the legal issue is of whether or not such a requirement could actually be an unnecessary invasion of the employee's privacy and hence a breach of their human rights. In addition to the testing process can be uncomfortable. So employees may feel that it's unnecessary and an unnecessary invasion into their private life and unnecessary generally if they're not exhibiting symptoms. And they may say, well, there are other ways to protect colleagues, there are other ways of protecting the public. So they will need to be thought through to determine whether or not this is the right approach to take. The other legal issue to consider relates to data protection. Well, of course it does. So data protection is a major consideration in processing sensitive personal data, which of course this is. The Information Commissioner's Office has published a guidance that confirms that obtaining health information about an individual is special category personal data, and an employer or controller in the situation can only process such data on certain grounds under the UK GDPR. The ICO's advice is that as long as there is good reason for doing so, and that's the key phrase, as long as there is good reason for doing so, employers should be able to carry out health testing on employees, as data protection law does not prevent them from taking the necessary steps to keep their employees and the public safe during the pandemic. Again, it goes back to what is reasonable, what is a good reason? Are there any other ways, any other means of protecting employees, colleagues, and the public that are less of an invasion and are potentially more reasonable in the circumstances? In terms of testing generally, the government will stop providing universally free COVID tests from 1st of April, which I've already mentioned. Until that point, both lateral flows and PCRs will continue to be provided free by the NHS. With the removal of free tests, after the 1st of April, if an employer requires mandatory testing of its employees, then it may well be reasonable for the employer to pay for those tests. Requiring employees to pay for their own tests may be considered unreasonable on the basis that the employer is making testing mandatory in the stated circumstances. If an employer is considering making deductions from employees' pay in order to fund a mandatory testing regime, then the employee's written agreement will be required to do that. And it is extremely important that such deductions do not result in employees' pay falling below the national minimum wage. Why an employee would agree in writing for deductions to be made from their pay in order to fund the employer's required mandatory testing program is very questionable. So it looks and appears that an employer is going to have to fund any requested tests themselves. If you or your business are thinking of stockpiling test kits before the 1st of April, then that's already been anticipated by the NHS, and there is a cap on the number of tests that can be acquired prior to the 1st of April. The 5th matter then to include in an employer's policy might be whether the employer will require employees to self-isolate or test if they have come into contact with someone who has tested positive for COVID. Again, there is no legal requirement for employees to self-isolate if they have come into contact with somebody who has caught COVID, even if they're living with that person in the same household. However, at the moment, it's considered prudent and reasonable for employees to take a test or more than one test in those circumstances. But again, if that's what you're going to require, then that needs to go in the policy. And again, if you're requiring testing in those circumstances, you may well have to fund that. So the 6th matter to be included in your policy is what health and safety rules and guidance employees should follow. And of course, this is an absolute minefield. The guidance has changed a number of times and then a number of times again. And it's very difficult to keep on top of it. And it's very difficult for any health and safety expert to keep revising any risk assessment to keep on top of the changes. On the 24th of February, it was announced that from 1st of April, the health and safety requirement for every employer to explicitly consider COVID-19 in their risk assessments will be removed. The intention of this is to then empower the businesses to determine what risks they are experiencing in their business or they anticipate experiencing in their business, and including those mitigating circumstances or mitigating factors in their risk assessment. So again, passing the burden on to the employer. It was also announced that from 1st of April, the existing working safely guidance will be replaced. And there's so much of it. So that's going to all be replaced with new public health guidance on which the government will consult employers and businesses to ensure guidance continues to support them to manage the risk of COVID in workplaces. We haven't seen that yet, or any drafts of it. We're running out of time, so we'll wait and see what is published. On the 14th of March, the TUC wrote to the business minister warning that workers' safety is being put at risk by confusion and mixed messaging over the announcement that COVID will not need to be explicitly considered as part of a risk assessment from the 1st of April. It points out that the employer's duty under Regulation 3.1 of the Management of Health and Safety at Work Regulations 1999 is to make a suitable and sufficient assessment of the risks to the health and safety of his employees to which they are exposed whilst they are at work. The TUC says this will obviously include risks from COVID, including the risks of long COVID. So the TUC are disputing and questioning the announcement that was made on the 24th of February about the removal of the reference to COVID in a risk assessment. We'll watch this space. Our view is that employers should continue to explicitly consider COVID in their risk assessments beyond 1st of April. And I'm sure that that is something that the public health guidance will refer to as well. Until after the 1st of April, then the existing working safely guidance continues to apply. The government first issued its non-statutory guidance in May 2020, when many businesses were contemplating reopening after the first national lockdown. The guidance then has been updated at various points since its original publication, notably in July 2021, in anticipation of the removal of the legal restrictions in England. At that time, the guidance continued to advise on sensible precautions that employers should take to manage risk and support their staff and customers as those restrictions were lifted. In December 2021, the guidance was updated to reflect working from home where possible and measures relating to face coverings. These measures ceased to have effect from 19th of January in respect of the guidance that working from home where possible, which was then removed, and in relation to face coverings from 27th of January. The guidance has been updated to reflect those changes. So there's currently 6 guides for particular workplace settings. Example, offices, shops, events, constructions, restaurants or pubs. And then with each setting out core priority actions for protection of staff and recommended measures that are common to all those settings. In addition to the working safely guidelines tailored to their specific workplace settings, employers should have regard to the priority actions that apply equally across all workplace settings to protect staff and customers. They're listed on the slide. Firstly, then, to complete a COVID-19 risk assessment, but as I mentioned earlier, potentially that's going to be removed from the 1st of April. Secondly, to provide adequate ventilation, and we know all about that, windows, doors being opened, etc. Third action, to clean more often, again, something that we're all familiar with, as well as hand washing and sanitizing. Fourthly, people with COVID-19 or any of the symptoms should be asked to stay away. So as I've also discussed, we've seen that change from the 24th of February, and people from that date are no longer legally required to self-isolate, but the guidance, the NHS guidance is supportive still of that. And then the 5th priority action is to communicate and train. And this means that workers, contractors and visitors should be kept up to date with those safety measures. Yes, it's worth noting that the working safely guidance doesn't supersede or it doesn't eradicate the existing legal obligations relating to health and safety or other employment or equality duties on employers. So we've got the Health and Safety at Work Act, which of course we're all familiar with, which imposes a general duty on employers to ensure, as far as reasonably practicable, the health, safety and welfare at work of all their employees. It sets out the basic health and safety duties of a company, its directors, managers and employees, and it acts as a framework for other regulations or statutory instruments that have been published. In addition then to that statutory obligation on employers is the common law under case law obligations on employers, and there are implied duties and contractual duties on employers. To take reasonable care of the health and safety of their employees and provide them with a safe working environment. So if then the guidance, the working guidance, is removed, then these two pieces, or at least two pieces of legislation and case law duties still apply. So it's imperative employers are still doing everything they can to ensure the health and safety of their employees in the workplace. And I think, therefore, that means that particular reference needs to be made in risk assessments for COVID-19.
Keeley, can I just ask a quick question?
Yes.
So we've had a question from Marie. She's asked, if somebody is poorly with symptoms of COVID, they can't work from home, we can't move them somewhere else in the building, and they refuse to self-isolate, what would you advise? Sorry, let me just work down what would you advise when they work with a colleague who is unvaccinated and or vulnerable? If we decide to send the positive person home, are they entitled to full pay?
Yes, to the latter question, because I think you're suspending them on health and safety grounds. So I think you'll end up having to pay them full pay in that scenario. You might get away with sick pay if that's of a lesser sum in your contractual obligations to an employee. But yes, if you are saying you need to go home and you have to go home, then I think you will have to pay them at least sick pay in those circumstances. That's why it's so important to have these policies, because if you have a policy which says we will not allow employees to attend work if they are experiencing symptoms of COVID or have tested positive for COVID, and in that situation you will be paid sick pay, there's your document that you can refer to support your actions in paying them sick pay. If you've got none of that documentation, then I think you'll end up either having to pay them full pay, or at the very least sick pay. So then going back to the initial part of the question, which was if the employee refuses to go into work, refuses to isolate, and they're with an unvaccinated employee
or vulnerable employee,
or a vulnerable employee, then I think you have to send them home. And as long as you've got that policy that supports your actions, because it's a weighing up of health and safety risks in that situation. And if you're going to be putting another employee who is vulnerable at risk, and there is no way, think through the scenario of, well, could the risk be alleviated by use of if both employees wear masks? Could it be alleviated if they keep their distance? But ultimately, if they're doing a job where they're in very close contact and nothing can be done about that, and say the vulnerable one can't even wear a mask, because some people can't, obviously, then I don't think you can do anything more than request that the employee go home, and you're suspending them in effect. But make sure you think through the alternatives, the other options to keeping both employees safe. But ultimately, if there aren't any other options, then I think it is a suspension in those circumstances, which you will have to pay them for. Yeah. Does that cover the question?
Yes, I think so. Marie, let us know if it doesn't. Georgie's just put something in the chat box saying that she'd be interested to know how employers are being cautious. Let me see if I can read this. She's interested to know how employers who are being cautious would rather employees testing positive to work from home or be on sick leave. Sorry, I keep losing the message. Sick leave due to not having the facilities or the ability to work from home, are communicating their policies to employees without starting a mass exodus. So I don't know whether anybody has got any.
Yeah, I think you've got to consult. Yeah, so I mean, if you read the ACAS guidelines on introduction of policies and generally introduction of policies, if this is not an updating exercise and this is implementing a new policy, then it's really important that you do this in consultation with employee reps if you have them, obviously trade unions if you recognise a trade union, but with employees generally. And you can present it in a way that is wholly reasonable, that, you know, with the restrictions easing, this is what we have in mind, we've thought this through, we're going to present it to you, please give us feedback. So when you draft your policy, you will initially then communicate it to staff and as a draft. And say, this is what we've been working on further to the easing of the restrictions. We've identified a number of areas that we need to consider and implement a policy to cover. And we will consult with you in small groups initially about that policy. So you introduce it in a group situation or even one-to-one situation if you've got fewer employees. And you talk through it with them, and then you ask them for their feedback on that policy, particularly if it is going to involve reductions in pay or situations where you are asking employees to stay at home, obviously now that the isolation requirements have eased.
Okay. Next question for you, Keeley. If somebody has COVID symptoms, won't take a lateral flow test due to cost, but stays at home, if this happens a number of times, so basically, you know, they feel that they're playing the system, they're thinking about not forcing someone to take a test even if we pay, how would you treat that? So if somebody isn't willing to take the test even if the employer pays, but they're saying that they have got symptoms.
Yeah, I think deal with it as a disciplinary matter, because if you're going to pay for the test and you are reasonably requiring the employee to take that test, and it's not just one refusal, it's a number of refusals, and they're refusing to come into work, I think that's what. Yeah. Then I think that's a reason to commence disciplinary action, and in those circumstances as well, you may well want to at least treat the absence towards any criteria or threshold that you use in commencing any capability absence management process.
Great, brilliant, thank you. I hope that answers your question. If it doesn't, obviously just comment in the chat box and we can go over things.
Yeah, I mean, if somebody's unreasonably refusing to take a test and remaining off work because they believe they've got COVID and the employer is paying for the test, obviously the employer needs to figure out why and ask them why they're not taking the test despite it being paid for by the employer. But I would say that's it could be classed as an unreasonable defiance, obstruction of a reasonable instruction.
Okay, brilliant.
So just going back then to the health and safety obligations, we can put our risk assessment, we can make it part of our policy, or we can refer in our policy to the risk assessment that we've conducted. We need to obviously decide what rules and guidance we want to put in each document. And in this policy, it's really going to be about what is reasonable practices to implement in the workplace to keep everybody safe. Okay, so reviewing or continuing existing practices to keep workplaces reasonably safe will be necessary. Yeah, I've said that the risk assessments can be detailed in there, or they can be referred to. So with all that, then it's worth considering that actually there's been a huge increase in tribunal claims citing health and safety concerns. They were up threefold from last year. So there was some 637 single claims relating to health and safety, which were lodged with employment tribunals in the 12 months to the 31st of March 2021. This is a 156% increase on the number of cases that cited health and safety concerns in 2019-2020. So where employees raise concerns about health and safety, they're potentially protected from unfair constructive dismissal, from detriment and dismissal by the health and safety provisions in the Employment Rights Act. And they're also protected from detriment and dismissal by the whistleblowing legislation. So once an employee makes a reasonable assertion that health and safety is being impacted or their health and safety is being endangered in the workplace, then ultimately they are protected from any detriment or dismissal because of that assertion. The most probable tribunal claims we could see are in respect of staff who have been dismissed for refusing to work on COVID-related grounds, or from employees who have resigned and claim constructive dismissal, citing an unsafe working environment due to the COVID protocols not being properly followed. It's essential, therefore, that we continue to adhere to appropriate protocols, appropriate practices in the workplace, and detail these, as I say, in our policies. The seventh matter then that can be dealt with in our policy is whether employees are required to be vaccinated. Again, a really contentious area, but one I think that we might have actually come through now. That there's no legal requirement for employees to be vaccinated, as we know, in order to attend work. This applies even in the healthcare sector, and the requirement was withdrawn for people working or volunteering in care homes on the 15th of March. However, an employer may choose to require its employees to be vaccinated, but care does need to be taken if you're going to adopt that approach. If an employee is suffering with a disability, which has resulted in them having been advised not to take the vaccine, then a dismissal or a withdrawal of a job offer on that basis that could amount to disability discrimination. Some employers may elect to reduce sick pay to minimum levels, statutory sick pay, for example, in respect of those employees who are absent from work with COVID, but who are unvaccinated. And we've seen these policies that have been adopted by Next, the likes of Next and IKEA, who have reduced their sick pay paid to unvaccinated employees, who were still being required to self-isolate for 10 full days if they had come into contact with someone with the virus, unlike vaccinated staff who from December were no longer required to isolate in those circumstances. A move, obviously, to not paying employees if they're unvaccinated will go beyond that, but it is certainly being considered by some employers. You need to be really careful if you wish to reduce sick pay in those circumstances to ensure that you're not breaching any contracts of employment. Sick leave on the ground of COVID may well actually be sick leave. Of course, if an employee is experiencing symptoms, it will be. And so if contractual sick pay is being paid to employees on sick leave, then of course it will catch those employees who are suffering with COVID also. I think the point really is for some employers that for those who are unvaccinated, they may well be suffering with the virus for a longer period of time, or they may want to isolate in more circumstances than if obviously an employee was vaccinated. So that's why employers are potentially looking at reducing sick pay in respect of unvaccinated employees, because of those longer absences, or because those employees are more fearful about coming back into the workplace and want to isolate for a longer period of time. So that's the reason. But as I say, we've got to be very careful with it. We've got to be careful not only from a breach of contract point of view, but also in relation to disability discrimination, because as I said before, if an employee is unvaccinated because they've been medically advised not to be vaccinated because of a disability that they're suffering with, then reducing sick pay in respect of that unvaccinated employee could well result in a disability discrimination claim.
Where do we stand, Keeley, on asking whether employees are actually vaccinated?
Yeah, I mean, it's a good point, because it's health. It's a health question. But I do think that you can, because you are, again, and it's a question that you're asking in order to protect both them and others, and the public and colleagues. So I think you can ask that question. Whether or not an employee will answer that question, who knows? Yeah.
Okay, thanks.
So then we've talked about communication of the policy. So it's not going to just be handed out to employees and said, right, this is our policy now. You're not going to get paid for the first 3 waiting days of any sickness absence, and we need you to isolate if you're experiencing any COVID symptoms, and we're not paying for any tests. So we're not just going to give the policy to our employees. We're going to consult with them about it and communicate with them about it, and gain any feedback before we formally implement it.
Okay, great, thank you.
If an employee doesn't agree to any changes, and the changes do incur changes to their contractual entitlements, then be very careful if an employee refuses to accept the new proposal, and seek legal advice. Just then a couple, 3 further matters to consider as restrictions are eased. And the first of these is determining and communicating the place of work model. So with the easing, obviously, of the restrictions, we will need to determine and communicate what place of work model we wish to adopt, if this hasn't been discussed and formalised already. So from the 19th of January, the government no longer asked people to work from home if they could do so. Now that the work from home guidance has been removed, the working safely guidance recommends that employers should talk to their workers to agree arrangements to return to the workplace, remain responsive to workers' needs, and consult with them on any health and safety measures in place to reduce the risk of COVID, and give extra consideration to people at higher risk or severe illness from COVID, and to workers facing mental and physical health difficulties. So that is in the working safely guidance, and that guidance potentially is going to be revisited and revised after the 1st of April. Clearly, if the employee's job can only be done on site, that determines the issue of the employee's place of work. However, if the employee's role can be conducted from home, then employers may or may not wish to continue with that arrangement of home working, or instead introduce a hybrid model with the employee working some time from home and then some time on the premises. In some cases, then, if an employer wishes employees to return to full-time office working, this may result in some conflict. The employees may say, or an employee may say, I'm not happy about this, I need to continue working from home, in which case the employer is then going to need to request that the employee make a flexible working request in respect of their place of work. And that is a topic which we dealt with last year. So please go on to your YouTube channel, Eloise, and then you can look at flexible working and flexible working policies. If the employer wishes to implement a permanent hybrid or a permanent home working model, there are a whole range of matters that will need to be considered. ACAS have produced a guide on hybrid working. It's very useful. It's probably one that you've all considered already. Most important things really are to consult with staff about the practical considerations of introducing hybrid working, support and manage staff who are going to be hybrid working, create a hybrid policy, and handle hybrid working requests from staff. Now, if employers decide to formalise a home working or a hybrid working arrangement, again, they'll need to address a number of practical issues. They'll need to consider amending the contract of employment. They'll need to consider introducing necessary policies, home working policies, hybrid working policies. They'll need to consider taking appropriate measures to protect confidential information, which is a big one with employees in respect of them working from home. How is that information going to be, how is your confidential information going to be protected? They'll need to review the health and safety implications of the arrangements, which includes carrying out risk assessments for employees working from home. You know, mental health is a big issue with many people working from home. You'll need to consider any equipment that needs to be provided, whether that's a chair, a desk. They'll hopefully already have the necessary IT equipment. And consider your insurances. You know, are your insurances going to be covering any issues that arise outside of the workplace if somebody's working from home? A big one, management and supervision of employees who work full-time or some of the time from home. It has to be extremely clear what the boundaries are in terms of working time, accessibility, and setting that all out in a document so everybody is clear. Performance targets, monitoring performance with employees working from home is of course more difficult than monitoring employees who are working from the office. So it's, you know, in terms of having telephone conversations with clients, you know, you're not able to listen to those employees and what they're doing. It's more difficult, obviously, to manage employees who are working from home. So make sure there are ways and means of assessing performance and making sure that employees are accessible at the times that they need to be accessible to teams or to their managers. And lastly, looking at the tax consequences of home working, because if the place of work changes, then firstly, an employee can claim travel expenses when they travel into work, and there may be tax consequences as well for them or the employer. Also, a matter to consider relates to vulnerable and extremely vulnerable employees. Do they need to be treated differently? And we have touched on this before. From the 15th of September, the shielding programme for clinically extremely vulnerable individuals in England ended, having been paused since the previous April. So now the extremely vulnerable are expected to follow the same guidelines as everybody else. But of course they are vulnerable, and therefore an employer's obligations towards those people are going to be higher than the other employees. And again, we go back to an employer's obligations under the health and safety legislation. So There is an ACAS guidance on this. It suggests that where the workplace is open and working from home is not possible, an employer and a person previously classed as clinically extremely vulnerable should talk as early as possible about how they'll return to the workplace, how they will work in the workplace, how the employer will ensure that the workplace is kept safe for them, any concerns that the employee has about returning to work or going to work, and any reasonable adjustments that can be made in respect of those particularly vulnerable employees who may have a disability. And if they can, and if you can, to discuss that possible hybrid working model to again ensure their safety. The guidance states that a doctor may still advise someone who is at high risk to stay at home, even though shielding has stopped. In these circumstances, the employer should check its sickness absence policy and sick pay rules. It should also talk with the employee to understand the issue and see how the employee can be supported. The employer should consider if the employee can continue to start working from home. Yeah, so the additional precautions that I've mentioned, together with any other advice from the individual's healthcare professional, will therefore impact on your decision about the feasibility of a return to work for a clinically extremely vulnerable person, employee. Yeah, it is going to be a difficult one to manage those extremely vulnerable in the workplace, particularly if they haven't been vaccinated. And then be mindful of mental health issues. We've talked a lot about mental health. There are so many cases of employees raising issues about their mental health, with it either impacting on attendance level, even if they work from home, or impacting on their workplace performance. So, or work performance. So we've actually done a topic on this last year. So again, you can have a look at that or listen to that if you need to do so.
Which is on the YouTube, Vanilla Recruitment's YouTube channel as well.
Yes, yes. So I'm not sure what the time is. I've got, bang on 3, isn't it? So what I can do, Eloise, is I can just record separately these 3 cases, or I can join you again on my own with you and just record those 3 cases that I was going to refer to, which just backs up some of the things that I've gone through, which I think might be helpful to people.
Definitely. Yeah, absolutely. Because a couple of people have had to say that they've had to shoot off to other meetings. So perhaps if we do that separately, Keeley, and then I can send it to everybody.
Yeah, that's absolutely fine. Yeah, that's great. We can sort that out, can't we?
Yeah, absolutely. Well, thank you so much, Keeley. That was really informative. Has anybody got any other questions that they want to ask before Keeley has to leave? No, doesn't look like, which is great. So if you do, then either email Keeley directly, or obviously you can come to me as well, and I can get questions to Keeley. But thank you very much for your time today, everybody, and especially to Keeley for all your help and guidance. And we will follow up with the case law for you. So thank you very much.
Thank you. Bye.
Bye.